Government has released an additional 23.7 billion kwacha for antiretroviral therapy treatment. Minister of Health Joseph Kasonde says government is indebted to cooperating partners for providing support to the fight against HIV and AIDS. Dr. Kasonde said this during a meeting between government and cooperating partners involved in the fight against HIV and AIDS. Earlier, American Ambassador to Zambia, Mark Storella, said the additional funding demonstrates that Zambia is taking decisive action to fund a greater share of the country's HIV fight.
I think that in appreciating the cooperating partners, we should also be sure that we make our contribution. The time has indeed come when we Zambians should see ourselves as the primary custodians of the health of our people, that the government of the Republic of Zambia has made available an additional 5 million or $20 or 23.7 billion kwacha for antiretroviral medications in Zambia. This is the beginning of our entry into self-sustainable development.
Here, this additional funding demonstrates that Zambia is taking decisive action to fund a greater share of the country's HIV and AIDS response. With the global financial crisis underway, it is essential that the government of Zambia or any government facing the HIV epidemic demonstrate this kind of leadership that you are demonstrating today. We applaud your government's actions, which will lead to provision of antiretroviral drugs for thousands of Zambians and therefore will save even more Zambian lives.
I sincerely congratulate the Ministry on this announcement of this extra funding for antiretroviral drugs today, and I wish to express CDC's continued commitment to supporting and working with colleagues in the Ministry. I've only been in Zambia 2 days. I was here yesterday and today. I have been extremely impressed, and I mean that sincerely.
Still on health, visiting director of Center for Global Health has praised Zambia's performance in the fight against infectious and other common diseases. Kevin de Kock says Zambia has recorded remarkable progress in the fight against HIV and AIDS, malaria and tuberculosis, among others. Dr. de Kock told Zanis in an interview in Lusaka that Zambia is a shining example on the African continent through its efforts in ensuring that it provides access to treatment by those in need.
The fight against HIV AIDS and the control of malaria. I think Zambia's done very well in the prevention of mother-to-child transmission of HIV, in the scale-up of treatment for people living with HIV. I think one area where more could be done is use of male circumcision.
Meanwhile, about 2.5 million